So earlier, President Cyril Ramaphosa announced the country is moving to alert level 2 of the lockdown. Professor Adrian Puren is with the National Institute for Communicable Diseases, and they've been working closely in monitoring the spread of the virus. Prof, a very good evening to you. The President was saying today that the worrying trend in the past week is that the country is averaging well over 3,000 daily infections. Just yesterday, in fact, we passed 4,000. Are we likely to see them peak further, the numbers?
Yes, certainly, and I think once we've reached a so-called level of, say, 5,000 and above cases, then within that, after that, I think in about 2 to 3 months, for example, we can certainly then head towards a peak. But again, these are just scenarios that are currently based on particular modelling approaches to the potential third wave. But I think all intents and purposes, we have reached that particular point, yes.
You mentioned a period of 2 to 3 months. Is that how long the lockdown may need to be?
Well, that's just to reach the peak, in other words, and then obviously we will see declines, and I think based on those declines one then can reconsider whether or not one can actually then remove, as we've done for the second wave, remove some of those particular restrictions. Obviously, as we go through the trajectory, of course, we've selected as a country to go for level 2, but of course, if events become more severe, then obviously maybe perhaps and more severe restrictions may have to be applied, or nuanced approaches around how those restrictions may apply. But for the moment, this is what we have selected as a country to introduce to manage the resurgence.
Is a change in curfew from 11 p.m. to 4 a.m., which is basically, an hour's difference from where we were previously, and, for example, moving gatherings to 100 people indoors, 250 outdoors, is that enough to arrest the spread of infections?
I think that these are the start of those particular approaches. I think one should try, in fact, if one were to take these seriously, in fact, to try and even ensure that, in fact, one could even lower those particular numbers. I think in particular the gatherings, and especially the social and family gatherings in particular, I think need to be considered, as well as, shielding of those individuals that are in the older age categories with comorbidities and so forth. I think those are the sort of key events that we should, in addition to the limitations that have been placed on businesses, to take into account. So I think there are multiple effects, and I think the stress is not just on the size. I think that's really critical, but it's also coming back to those non-pharmaceutical interventions. And again, the government has stressed quite clearly that those are really the key factors that will really contribute to try and stave off as much of the numbers that we can, if at all possible.
Pardon me, Prof. Is it too soon to start having a conversation about reopening some of the hospitals, field hospitals, that were opened at the beginning of the pandemic last March, which have since been shut down precisely because we've seen from the health department's last note about a 17% or so increase in hospitalizations?
So again, there are various scenario plannings that are underway, and those will really determine what the trajectory looks like. Perhaps more in real time, what can make those types of decisions, whether or not, in fact, your capacity around bed capacity or oxygen supply will require additional facilities to be opened. So I think the provincial departments of health, I think, work very closely with the National Department of Health and the NICD to look at these scenarios and then make those decisions. As you know, the initial scenarios around this particular resurgence show that it should not reach to the same extent as we had with the second wave or second resurgence, except for Gauteng. So again, if we keep to a more, and that comes back to the fact that if we apply those non-pharmaceutical interventions quite strictly, then we should not see it as severe a scenario. But however, if we do not adhere to those non-pharmaceutical interventions, limit movements, for example, then of course we have a different scenario and poorer outcomes.
I'm looking at just some of the immediate reaction online from South Africans who say, look, we are again being asked to basically be super careful, watch where we go, do not gather unnecessarily, sanitize and the rest of it. And they're saying, well, I mean, why should we do that when the government has not kept its end of the bargain? It's not vaccinating people to target. There isn't a lot of information about whether we'll be able to even meet the target set for the vaccination of the over 60s by the end of June at this stage.
Yeah, so again, I think we need to be cautious around conflating the vaccine program and this resurgence. The resurgence planning has really not factored into account the vaccine program, because I think we realize that the focus has really been on the healthcare workers, and I think that, to me, is an important step. When we're thinking about the resurgence, the healthcare workers are a fragile group of individuals in terms of mortality, morbidity, and so forth with regard to COVID. So I think it was essential that we focused and provided the vaccine to those particular individuals, which I think is going to be, I hope, on target. So I think the program, the broader program, yes, I agree that we would like to have seen greater progress, but I think there has been various problems that have beset this particular program, not always of the South African government's making, for example. So I think we just need to be cautious how to interpret that, but I think it's important to realize that this particular phase, this particular resurgence did not model the fact that we would have a large-scale vaccine program at all.
I suppose the difficulty with not conflating the two, Prof, is that it's very hard to do when this is ultimately, for many people, a life-or-death situation.
Absolutely, and I think that is why I think there's still this great emphasis. I think we have a vaccine or vaccines that are now coming online and will be rolled out, but I think given the fact that we've not reached that level, in fact, there's only 1% of the individuals would have been vaccinated, and also taking into account, that we've had a large resurgence, and so there is a degree of immunity that is found in South Africa. It may well go up to about 30 to 40% in some particular areas, and that's why I think we predict that this resurgence may not reach the same level. So I think as a South Africa, we have a degree of protection. Certainly the vaccine will be wonderful to have, but again, we may not reach that level of herd immunity. So I think we just need to focus on what are the key areas that we need to discuss and then focus on that. That's why I think the emphasis, unfortunately, remains. I know you speak of so-called COVID-19 fatigue. I don't think it's about fatigue. It's a matter of just keeping in mind what we need to do on a day-to-day basis as at an individual level, but also what we've been instructed to do in order to protect ourselves.
Prof, Professor Adrian Puren with the NICD, good to speak to you as always. Thank you, sir.